IV insertion procedure. Verify order, gather appropriate supplies and equipment, prime extension set, flush IV lock with 3 mLs of normal saline. Keep syringe with normal saline attached to IV lock. Perform the 5 eyes. Introducing yourself.
Hi, Mrs. Smith. My name is Mark. I'm going to be your nurse today.
Infection control, hand hygiene. Identifying the patient, Francis Smith.
Hi, Mrs. Smith. Can you do me a favor? Can you please state and spell your first and last name and state your date of birth?
Francis Smith, Francis Smith, and my date of birth is 3/17/1927.
Perfect.
Informing the patient.
Okay, so what I'm going to do today is I'm going to insert an IV for you.
Include the patient.
Okay, is there a particular arm that you would like me to use?
Also, check and verify limb restriction and allergies. Create a clean work area at the bedside and set up equipment. Select the appropriate insertion site. Consider duration of therapy, type of infusion, condition of veins, and any limb restrictions. Use non-dominant arm if possible. Assess the vein to determine that the selected vein can accommodate the cannula. Place the patient in a comfortable reclining position, leaving the arm in a dependent position to increase capillary refill of the lower arms and hands. If skin is cold, consider the use of warm packs to promote vasculature dilatation. Apply tourniquet about 3 inches above the intended puncture site. Remember to check radial pulse. If pulse is not present, remove tourniquet and reapply with less tension. Ask patient to open and close their hand. Choose a vein that is long, straight, and wide in diameter. Palpate vein to ensure that it is round, firm, fully engorged, and resilient. Release and remove tourniquet. Tourniquet may be left in place for no more than 3 minutes while locating suitable vein. Prepare the site. Remember to clean the site utilizing friction with chlorhexidine gluconate 2% antiseptic using a back and forth motion for at least 30 seconds. Allow to air dry for 30 seconds. Reapply the tourniquet. Now it's time to insert the catheter. Put your gloves on. Remove catheter guard and ensure that the bevel is up. Prepare the catheter for insertion. Examine catheter for cracks or flaws. Inform patient that a pinch will be felt upon insertion and that you are about to insert the needle.
Okay, Mrs. Smith, you're going to feel a little pinch. I'm going to insert the IV, okay?
Okay. Hold skin taut approximately 2 inches from insertion site with one hand while holding the catheter with the bevel up in the other hand. While maintaining aseptic technique, insert catheter at a 0 to 15 degree angle into vein parallel to the straightest section of the vein in a continuous motion. Follow the path of the vein and insert catheter towards the side of the vein wall, while visually monitoring for blood return. Level the insertion device slightly by lifting the tip of the device up. Place index finger on the push-off tab. Thread the catheter to the desired length. Release tourniquet. Grasp the cannula hub to hold it in the vein and withdraw the needle by activating the needle release button. Attach saline lock to the hub of the catheter. Aspirate for blood return to ensure catheter is in the correct location. Flush IV lock with 5 mL of normal saline. Secure the hub of the catheter and cover IV site with sterile transparent dressing. Loop the IV tubing or IV extension tubing on the patient's limb and secure with tape. Label dressing with initials of person who inserted the catheter, date of insertion, and gauze size of the catheter. Assess insertion site for bleeding, hematoma, ecchymosis, and pain. Dispose used needle into nearest sharp container. Perform hand hygiene and document in the medical record. Always remember to dispose of your tourniquet. Remember to assess site for pain, redness, swelling, altered temperature, hematoma, leaking. Remember to document date and time of insertion, use of visualization technology, type, length, and gauge of vascular IV device, anatomic location of the insertion site, number of attempts, assess and functionality of the vascular IV device, if applicable, type and flow rate of IV solution. IV insertion removal. Verify order and indication for removal of peripheral IV catheter. Gather appropriate equipment. This includes gauze, clean barrier, and gloves. Perform hand hygiene. Verify patient identification using patient identifiers.
Okay, Mrs. Smith, can you do me a favor? Can you state your first and last name and state your date of birth, please?
My name is Frances Smith, and my date of birth is 3/17/1927.
Perfect. Can you spell your first and last name as well?
FRANCISSMITH.
Great.
If necessary, check the medical record number as the third identifier. Prepare equipment and open gauze pads. Place a clean barrier and don gloves. Gently remove the transparent dressing, pulling the edges back towards the insertion site. If present, remove catheter securement device. Inspect catheter skin junction for signs of infection or phlebitis. Hold gauze over the puncture site with one hand and withdraw the cannula with the other hand slowly and smoothly while maintaining the cannula parallel to the skin. Apply pressure over the puncture site until bleeding has stopped, a minimum of 30 seconds. Assess integrity of removed catheter. Reassess puncture site and apply dressing as applicable. Document in the electronic medical record or designated section. For more information, please refer to the System Policy and Competency located on the Northwell Health's intranet. Thank you.